Hello everybody. When I talk about fluoroquinolone antibiotics and the guidance provided by the FDA, I usually say this. Since 2016, one of the black box warnings for fluoroquinolone antibiotics like Cipro, the one that I took, contains a black box warning for permanent and disabling side effects. The warning also says that these antibiotics should not be used for simple, uncomplicated UTIs because the risk does not outweigh the benefit. And lastly, this warning says, due to these permanent and disabling side effects, fluoroquinolone antibiotics should be used as last resort only when no other treatment options are available. And this is when I say, if your doctor is prescribing you a fluoroquinolone not as last resort, please ask for an alternative. And a natural response to this question is, what's an alternative? The answer to this question is not as straightforward as it seems. In the case of urinary tract infections, whenever you go to the doctor, emergency room, urgent care, whatever it may be for urinary tract infection, you must request a urinalysis and a culture. Without a culture, no doctor can tell you what is the exact medication you should be taking. They're just making their best guess without that information. And in fact, this is why fluoroquinolones get used so frequently, even though it's against FDA guidelines. It's because fluoroquinolones are broad spectrum antibiotics, which attack many bacteria, so it's easier just to give someone a heavy hitter, and the likelihood that it's going to get rid of the UTI, regardless of the organism, is pretty high. So, what are the alternatives to fluoroquinolones? Test, don't guess. Find out what the organism is that you have for any kind of infection, not just a urinary tract infection. And then a list comes out that tells you all of the antibiotics that that bacteria is susceptible to. That way, a doctor can pinpoint the most effective antibiotic for your infection. And it usually doesn't need to be a fluoroquinolone. Another thing that people have said to me is that they've been prescribed macrobid or nitrofurantoin as first line for an antibiotic. That's a much safer protocol than prescribing someone a fluoroquinolone. However, when that antibiotic doesn't work, people have told me that the next antibiotic they get prescribed is a fluoroquinolone. The patients believe this is their only option because the first antibiotic did not work. But that is not the case. Again, fluoroquinolones need to be used as last resort only. So if that first antibiotic didn't work, what are your other alternatives before taking a fluoroquinolone? Any doctor or prescriber should be able to tell you that with a culture. And in some cases, fluoroquinolones really are the last resort. And in this case, you just need to do certain things to protect yourself from potentially experiencing fluoroquinolone toxicity syndrome. Not that any of these measures will definitely prevent you from getting floxed. However, it is known that while you are taking any fluoroquinolone antibiotic, you should never take any form of steroids. You should never take any kind of NSAID, which is ibuprofen, Motrin, Aleve, etc., etc. And you should not be working out. The other thing that people don't know, if you have a connective tissue disorder like EDS, you should not be taking fluoroquinolone antibiotics. The same goes for anyone out there that has myasthenia gravis. There is a black box warning for both these categories that I just mentioned. I hope this helps. Be safe and always ask for an alternative if there is one. Thanks, everybody.